everything that you need to know about Michael Porter Jr.'s back injury. So Michael Porter Jr. was one of the top prospects in the NBA draft this year. At 6'11", the man could shoot, dribble, an unbelievable scorer, athletic, plays great defense, and I've said this before, there's a reason why a lot of people were comparing him to the likes of a Kevin Durant. And coming out of high school, a lot of people even had him going as the #1 pick in this year's NBA draft, ahead of guys like DeAndre Ayton, Marvin Bagley, and all those top picks. But unfortunately, 2 minutes into his first college game, he suffered a back injury, and that same injury would cause him to miss all but 2 games in his short college career. And in those 2 games which he came back after surgery, you could tell he wasn't 100% back to health. And fast forward to the pre-draft workouts, he would end up suffering a minor hip injury that a lot of people would end up over-exaggerating, but he would end up sitting out a few workouts. But with that being said, that same hip injury was connected to that back surgery he had during college. But knowing how severe back injuries can be and the uncertainty of them, especially to professional athletes, caused them to fall all the way down to the 14th pick to the Denver Nuggets. But as a Nuggets fan, I couldn't be any more happier, and just knowing what this guy is able to do when healthy, picking him is a risk that I'm willing to take any day, because when healthy, he could have been the #1 pick in this year's NBA draft. This guy is just pouring with talent. But as you already heard today, I'm gonna be explaining to you everything that you need to know about Michael Porter Jr.'s back injury, and why you shouldn't really be too worried, and why the Nuggets is the best situation he could have been drafted in, and the possibility of him playing next season. And if you guys had any lingering questions about his back injury, hopefully I'll be able to answer them by the end of this video. But you know, I'm not a doctor, but I'm gonna try to explain it to you guys the best that I can. But the first question we gotta ask is, what is wrong with Michael Porter Jr.'s back, or what is his injury specifically? Now, Michael Porter Jr. has something called herniated discs in his lower back, and last November, Michael Porter Jr. had minimally invasive back surgery called an L3, L4 microdiscectomy to treat the herniated discs in his lower back. And all the pain and discomfort he was dealing with was caused by small tears in the outer layer of the intervertebral discs that allowed important lubricating material to leak out. So if you're still kind of confused, I'm gonna explain it to you the best that I can. Now, between the bones that run down your spine, there are these soft cushions, which are the discs, and these cushions allow you to move, run, jump, lift heavy objects without feeling any pain whatsoever. Now, in Michael Porter Jr.'s case, think of the discs like a jelly donut, and if you poke a hole in it and squeeze it, all the jelly in the donut is gonna come out. So overall, Michael Porter Jr. has small tears in one of the discs in his lower back, and when he's doing any sort of movement, it causes the liquid to leak out, and that's where all the pain is coming from. But it doesn't really sound that big of a deal, and the reason behind that is because it's really not. And if you're an athlete or anyone suffering from back pain, this is the best scenario you could wish for, because it's an easy fix and it doesn't really affect you whatsoever. And actually, herniated discs are fairly common. They happen to everyone over time with wear and tear. Think of it like a tire. But that's going to lead us to our next question. Well, why did it happen to Michael Porter Jr.? Well, a herniated disc doesn't happen all at once. The pain builds up over time, and sometimes genetics may play a small role in it, or it could be caused by repeated stress in one region of the back, like grabbing rebounds or over-rotating the back on passes, or just things along those lines. So that's going to lead us to our next question. How gruesome is the surgery procedure? And the answer to that is, it's not gruesome at all, if any. Also, the surgery procedure is also not that long. You come in for the surgery and then you're out the hospital the next day. It's that fast. And basically what they do, I'm not gonna go into all the details, but they cut a small hole in your back and go through some muscle and bones to get to the herniated disc. And once they get there, they clean it and take out all the liquid that leaked out of the disc, but they leave whatever is left in there, and then that's it. There's really not much to it. That's why I mentioned before, if you're an athlete or anyone suffering from back pain, this is the best scenario that you could wish for, because it's a fast and easy fix and it doesn't really affect you. But after surgery, you're gonna need some time to rest. Also, with that being said, patients who's done this type of surgery has said they felt better almost instantly. But that's going to lead us to our next question. Well, why did he look so bad in those 2 games he returned to in Missouri? And the answer to that is because after surgery for the herniated disc in his lower back, it's going to take time for him to get back to 100%. And it's something you can't really rush, and it takes a long time. And that's the same reason why he had those hip spasms during the pre-draft workout. It still seemed like he had some weak leg muscles from the herniated disc surgery that he had in college, and has to work on getting his strength back. And that's why I said before, the whole hip spasm thing during the pre-draft workout was over-exaggerated. But I will say this, yes, he could be prone to having this same injury again, but studies show that there's only a 10 to 12% chance of him re-injuring it over the next 5 to 10 years. And even if he does re-injure it, it wouldn't be that big of a deal. He'll just have to restart the whole process of recovery once again. But it shouldn't affect anything basketball related like running, jumping, shooting, or things along those lines, and he should be able to get back to peak performance. So how worried should you be about Michael Porter Jr.'s injury? So for any Denver Nuggets fans out there, or even Michael Porter Jr. fans out there, I wouldn't be worried too much about Michael Porter Jr. because, for one, the hip injury that he suffered isn't as bad as it's made out to be, and also studies show that it's not totally uncommon among NBA players to have herniated discs in their lower back. Also, the Nuggets have one of the best medical staff in the NBA. You know, unlike the Philadelphia 76ers with that whole Markelle Fultz situation. And time and patience is something they'll be able to offer to Michael Porter Jr. because they already have a lot of proven players on their roster like Jamal Murray, Gary Harris, Nikola Jokic, Paul Millsap, and the list could go on and on and on. And yes, I could see him possibly playing next season, but I'm pretty sure the Nuggets will take the more cautious route and could sit him out the whole season because that's a luxury that he can afford. Also, we've seen what sitting out a season did for Ben Simmons, and I'm pretty sure it will do the same for a Michael Porter Jr. But now knowing more about his back injury, I'm confident that the Nuggets will be able to get him 100% back to health because this guy, when healthy, has proven he could be a superstar in the NBA. But hopefully I was able to answer some lingering questions that you guys may have had about Michael Porter Jr.'s back injury, and hopefully you leave this video with a better understanding about it. But with that being said, that is all I got for you guys today, and if you enjoyed the video, please leave a like, share, subscribe for more NBA content. And with that being said, I hope you guys have an amazing day, and I will see you all later. Peace.